Hi, I'm Dr. Vikram Garneja, and I am heading Pediatric and Pediatric ICU Department at Manipal Hospital, Dwarka, Delhi. As you are well aware that we have many season in our country, especially in North India. We go through winter season. Winter season is followed by spring season. Then we have summer, monsoon, autumn, and then again winter. Every season, I think we should enjoy each and every season, but every season bring their own issues. And today I'm going to speak about winter season and its related issues. So in winter season, especially in North India, we face a very cold weather, and obvious the pollution also goes very high at that time, and there is a spurt of viral infections. So first, I'll let you know about why this spurt of viral infection happen and how we need to prevent this. So our surroundings are surrounded by multiple microorganisms, right? And all these microorganisms have different viable temperature. So when there's a winter season, there are a lot of viral infection which become alive at this time, and they start infecting, especially the vulnerable population. And that vulnerable population is either pediatric age group or our elderly age group. So, in pediatric, what most of the time we have is viral infection, and those viral infection are usually related with fever, cold, and cough. And these viral infection can be easily prevented by using proper hygiene measure like proper cough etiquettes, proper use of masks, and doing hand hygiene. And these infection can also be prevented by vaccinating a vulnerable population, that is pediatric and elderly population. We must give them a flu vaccination, especially to less than 5 years and those who have any comorbid condition, and to our elderly population more than 65 years. So there are certain myths also associated with when children get viral infection, like parents stop giving bath to the child. They prefer to give only one type of diet. I will suggest that we need to avoid this. I think we prefer to give daily bath, proper hygiene practices, good intake of fluids, and as the infections usually decrease their appetite, so prefer to give them whatever they like it. So at least we need to give them energy-rich diet. Khichdi is one thing which is very famously, made in our houses because that is energy-rich diet. So with winter, there are also many allergens also come into the air. Cold weather itself is a allergen. Pollution itself is allergen. So those who get recurrent cold and cough or recurrent respiratory issues without fever, they usually have these type of allergies. So when they have these repeated symptoms, those symptoms are persistent, prolonged, and then we need to start thinking of allergies. Allergies can be either of nose or of chest. Nose allergy usually present with the repeated cold and cough. The symptoms are mainly nose block, running nose, or throat itchiness. The chest allergy can present with dry cough. You can have some chest tightness. There can be also difficulty breathing or especially fast breathing in pediatric population. So if the children are having repeated type of these symptoms, and those are following specific type of pattern, like last winter also the child had same symptom. This time also the symptoms are persistent, prolonged, and following the same pattern as the child had last time. So start thinking of allergy. If you start thinking of allergy, please visit your nearby doctor and start getting preventive treatment for that. So if your doctor make a diagnosis of allergies, the best way to avoid allergies is avoid the allergen. And the common allergen is house dust, pets in the house, cold weather. So these need to be avoided. For house dust, we need to make sure that proper when the house is getting clean, the dust remain in the air for a long time. So just make sure once it's settled down, which usually take 20 to 30 minutes, then only bring your child inside that particular room. And for the allergens, we have now specific treatment also, and these patients also need to be vaccinated to prevent repeated viral infection, because they're more exposed to virus, and they can have symptoms of viral infection also coming up with the allergies. So these patients also need to be vaccinated regularly. So there are certain myths also related to allergy, like food allergy. Food allergy is not that very much common. I think if you are associating with particular food, please tell your doctor and make a proper diagnosis before just restricting that diet to your child. And most of the allergens are usually airborne, and these can be easily prevented by using N95 mask. We have learned in the COVID. Now these are easily available, and most of us have also learned how to properly use this mask. So be safe in this winter season. Thank you.